Hello and welcome to Contagion, Dr. Hotez.
No, thanks for having me.
So, could you tell us a bit about your background in infectious diseases for those who aren't aware?
Sure. I'm an MD PhD laboratory investigator interested in vaccine development. I'm a vaccine scientist, pediatrician scientist, also trained in pediatric infectious disease. And I'm the dean of our school. I'm a professor at Baylor College of Medicine in pediatrics and molecular virology. I'm also dean of our School of Tropical Medicine and co-director of our Center for Vaccine Development at Texas Children's Hospital.
So, to start us off, could you tell us a bit about what the October plan entails? This is a recent publication of yours.
Yeah, I've been, my day job is to accelerate new vaccines for poverty-related neglected diseases, and we've been leading efforts to develop a low-cost, accessible COVID-19 vaccine for middle-income countries, low and middle-income countries, and now we'll announce soon a new vaccine program for India for a vaccine we're developing for COVID-19. Excited about that. But also I've been speaking a lot to the nation on CNN and MSNBC and Fox News about why COVID-19 is such a devastating illness, especially in low neighborhoods, and the fact that it seems to be going on uncontrolled across the U.S. The southern U.S. has about 20% of the new COVID-19 cases right now, and as bad as it is in the southern U.S., it's still accelerating. We had 1,500 deaths yesterday, so the deaths are climbing back up to March, April levels, and we're also now seeing this virus advance north from the south into Tennessee, Ohio, Indiana, Illinois, the Ohio River Valley, and we don't seem to have any plan to stop it. So rather than just document the apocalypse, thought I'd put a suggestion out there since they're forthcoming and microbes and infection. I put out very quickly this October 1 plan that says we can get back down to containment mode across the nation. We could talk about different definitions of that by October 1 if we do the hard work now. For some states, there's not much work to do at all, like up in northern New England, Vermont, New Hampshire, Maine, but for others like here in Texas or in Florida, there's a lot of work to do. But the point is, if we can do that, get back down to some agreed upon level of containment nationally, with each state's having different degrees of work to do for that goal, then we can open up schools safely and make teachers and staff feel safe. Then we can open up even colleges and potentially even sporting events again. But we need to do that now. We really have no choice because things are spiraling out of control at this point.
So I'm sure this is a back and forth complicated sort of thing, but what are the areas where the federal government can really step in and coordinate a response versus to what extent is the U.S. response affected by the federalist sort of restrictions in the Constitution? You know, Germany, for example, has a somewhat similar federalist setup, but that's 16 states across a much smaller area.
It is what we call it the United States for a reason, sometimes more states than united and at times like this. And, the European countries have done this, right? They've enacted national plans to contain the virus, and people are sitting in cafes in Paris and elsewhere, and they're doing it in Canada. The U.S. has been more challenged because the CDC historically has always had the states in the lead. And in the case of this COVID-19 response, it's still the states in the lead, with the U.S. government providing some critically needed support, manufacturing support for ventilators and FEMA support and supply chain management, but it's failing, right? Or it's failed. It's failed miserably, right? We have the worst COVID epidemic globally by far, 150,000 deaths. We hit that benchmark this week. We're drowning in virus and people are dying, and not just dying, also many more than the number of people who have died are having long-lasting injuries to their lungs, their vascular system, their heart, their brain, and the country's going to have PTSD, collective PTSD around this for a long time. So we've got to get control. And the way to get control is to say, look, we've been doing it the same way since February, March. It's not working. Maybe we need to try something different. And the October 1 plan says we need a federally led response out in front with the White House behind it, talking about it every day and really providing directives to the states to say what's needed. And if the states don't want to comply, well, then there are, mechanisms beyond the force of law to make that happen. But, we've got the federal government's got to take some ownership and leadership on this. So far, they've not been willing to do it. And I don't know what they think is going to go better on its own. We're at 150,000 deaths now at the current rate. Will easily be at what Chris Murray at Seattle says will be 220,000 deaths by October and 300,000 deaths by the end of the year, if not more. And it's the country's destabilized as a consequence, and just screaming at the teachers saying, just stop complaining and go back to work is not going to be effective. The teachers are scared and they're basically saying, hell no, we're not going to do that. And if the schools can't reopen, then parents can't go back to work and the whole thing collapses. So we're in this very chaotic situation where there's nobody out in charge. And this is why I think it's also a homeland security threat, as well as an economic threat, in addition to being a public health threat. Here's the situation. Right now, right now here in Houston, where you have 1,200 new cases a day. So we're not going up vertically or accelerating in new cases every day. We're plateaued, but we're plateaued at about 100 miles an hour. So we have 1,200 new cases a day in Houston. And as we know, the testing underestimates by a lot, right? So there's probably more like 5,000 new cases a day. When you have 5,000 new cases a day in a city like Houston, there's no way you're going to open up schools and teachers or bus drivers and staff are not going to get sick. They are going to get sick, and some will go to the hospital. And as soon as that happens, the whole thing collapses. Teachers will not show up for work. Bus drivers will not show up for work. People working in the school cafeteria won't show up for work, and the whole thing will derail. It's just common sense that will happen. And so the idea now, there are parts of the country where things are not nearly as bad, and potentially you could open up schools there, but it's all in a very fragmented way. If you could enact my plan, get us all the way down by October 1, at that point, what you can do is all of the contact tracers that we've been hiring over the last few months, now they're in place. Now you can do contact tracing. You can't do contact tracing in a city when you've got 5,000 new cases a day. It took a huge percentage of the Harris County Health Department to do the contact tracing for the 4 measles cases we had last year. So the idea that you're going to do that with 5,000 cases is ridiculous. So we can't do anything. We can't do contact tracing. The testing is overwhelmed, and teachers can't feel safe. So if we can bring that our whole nation down to a reset point at a very low level, and I don't want to prescribe what that low level is. Health Metrics, Institute for Health Metrics says it's 1 new case per million residents per day, 1 prevalent case per million residents per day, but maybe we don't have to be that draconian. Bringing it down to some agreed upon level where we can then make our public health effective, get masks on people. At that point, we can at least prevent the resurgence and have a pretty reasonable fall, unless we get another wave in the winter, as people like Mark Lipsitch and Harvard predict. But we'll deal with it then. And then eventually, over time, we will have some vaccines out by the middle of 2021. And if we have that mindset that we're still doing public health, even if we have partially protective vaccines that are not interrupting infection but reducing severity of illness, we can better incorporate them into a public health infrastructure. And this idea of waiting for a vaccine is ridiculous because some of them may be partially protective and will still need the contact tracing and the masks and everything else.
So with the level of spread that does take place within households, there's a question around what we're recommending for essential workers, especially in some of these intergenerational homes. And should they be wearing masks inside? Is there going to be some sort of provision where older members can go get a hotel that they can't afford out of their own budget? It also brings up, is it possible to reform long-term care facilities to improve outbreak control within them as we undergo this?
Right, but not when there's that raging level of transmission. So the point is, if you're let's say you're in South Texas right now, where probably the epidemic's at its worst in Hidalgo County or in Starr County, it looks pretty clear that those places will need a full lockdown to get to some meaningful low level of transmission. And then those issues are not really there. In areas that are less severe, you may not have to have that level of that draconian level. So I'm not entirely certain I understand your question. What I'm basically saying is adjust your state or your region to the area to the level of transmission, do whatever it takes to bring it down to that level. And then you can start reopening slowly, again, with masks and everything else.